think the different psychological therapies are really interesting and seeing how some patients do well with one and maybe not as well with another. I know when we're incorporating them into the physical therapy goals, the ACT or the ACT concepts have action steps that are behavioral based, and that really helps correlate with the physical therapy goals. So if, for example, their value is being more independent, their action they would take would be to go on a walk or to take care of themselves and to brush their own hair. And so that helps correlate really well with the function. So I feel like the ACT-based concepts correlate better with the function when we're doing physical therapy and psychology together. I would say that all of the physicians can refer, and then usually the psychologist decides with the patient which therapy is best for them, if that makes sense. So usually the psychologist is deciding, helping them figure out, are they going to respond better to maybe a CBT approach versus the ACT approach. There's definitely some different things covered in the ACT approach, and it's very more emotionally based. And so if someone's coming in with a perspective that's very, I would say psychologically naive, that they do better with the CBT approach first, because they need to learn that pain psychology is important or how they're thinking might be important. So it's kind of a stepping stone, if that makes sense. Yes. So the content would be basically someone's story. So I have back pain when I started 20 years ago when I was lifting something and my disc slipped and blah, blah, blah. The content of that experience, yes. And the context would be, what are you doing today, like now in this environment? Does that make sense? So it's shifting kind of from the past and their story, the content of their thoughts and their experience to, okay, but now today, do you want to help lift up your grandkid or not? So it's kind of shifting that from content to context, which is hard. Oh yes, they have no idea what they're getting into. I would say that it's not scary to start something new. What we spend a lot of time going over is how what they've done so far hasn't really worked to get them ready to try something new. A lot of the metaphor they use is kind of you're burning down the forest to build new growth. So this is a questionnaire, and usually it's used more for the practitioner. It has a subset of questions that have rumination, hopelessness, and magnification. So it might be, my thoughts and worries to me come true all the time, or I'm always worrying about my pain. So that would be the worrying, the rumination portion. And then there's a clinical cutoff score of 30. So if someone has more than 30 on that score, that would be significant. And what we found is that if it is significant, maybe that person should have a CBT or a catastrophizing intervention on just that aspect before maybe they start the deeper therapies or the getting into the physical therapy and getting into the gym. I guess the big thing that I wish for my field is that it was just more collaborative. So there's more communication between all the fields, physical therapists, psychologists, medicine, and I do see the shift towards patient-centered care, and I think just everyone being on the same page and really being an advocate for their patient and helping them function. I want it to be easier for the patient to access everything they need. If they need the pain psychology and the physical therapy, that's what they get. If they need more procedures, that's what they get. So I'm hoping it makes it easier, but I'm certainly healthcare, and specifically like our country and different things, it can be more difficult than we would like. I think that some of the other countries have actually done a pretty good job of getting that more complex care model down, and that it is hard for people to get specialized care and more specialized treatment, and there are some hoops to jump through. I know, for example, if you have pain, the first person you're seeing is probably not going to be, and you're also depressed, not the pain psychologist, but maybe it should be one of the people in your treatment plan, and perhaps in the other models of care, because healthcare is easier to access, it is easier. So I'm not sure how to do that, if they have a step care model that's easier to access, but I'm sure America can look at Europe and Canada to help with that. They also have better treatment outcomes than we do right now, actually.